This is a opportunity for members of the audience to be heard at this time for anything that's not already on the agenda. Board of Health? See none. All right. We'll go on to the approval of action items. Do we get a motion to approve A through T? Wow. Wow. Can I get a second?
Second.
All right.
Okay, Festerson,
Yes.
McNally,
Yes.
Wilkins,
Yes.
Weiss,
Yes.
Linder.
Yes. All right. The health director update.
Well, good morning, everyone.
Morning.
Morning.
So we have several really great presentations for you, so I'm not going to be real long-winded this morning, but we do have some really important things to acknowledge this morning. The first of those is that we are very saddened to announce that we lost a team member on June 8th. Miss Cheryl Bronson passed away after a very long and very hard-fought battle with cancer. And for those of you who don't know Cheryl, she worked in our health promotion program, and she really was one of the founders of health equity, if you want to kind of frame it that way in our department. She was with us for 26 years as of June, so she was with us up until the very end. And we're very saddened to have to say goodbye to her. And I was very honored to be able to attend her memorial service last week. And it was just the most beautiful service. You could really tell that she had a huge impact, not just on the health department, but really on her entire community. And so we, of course, hold her family in our thoughts and in our prayers as they work through their grieving process. I remember the first time I met Cheryl, it was just a few days after I started this position, and I held a series of Ask Me Anything meetings with staff. And basically, this was a meeting where anybody could sit down and ask me truly any question that they wanted. And I got everything from who's my favorite sci-fi character to Cheryl's question, which was, Dr. Hughes, we're glad you're here. What are you planning to do about racism and discrimination in the health department? That was her very first question, and she was known for being incredibly direct, but also incredibly kind. And really, we would not be where we are today, moving toward a more equitable health department, if Cheryl hadn't been here. And so we really want to honor her. And if you don't mind, I would really like to take just a moment of silence for her. Okay, thank you. Moving on, we also have a couple of time and service awards to discuss today. The first of those is Miss Vanessa Wagner, who is one of our disease investigators in our STI control program. Vanessa has been with the county for 30 years, and she's been with us for 25. And I just have to say that she has been just an amazing asset to our department. She has served in her role just faithfully, and is, as a nursing background, is also just extremely committed to her patients and doing the right thing for the people that she serves, which I so appreciate in her. She's also always willing to lend a hand to her coworkers, including one who has been going through quite a bit and has had some trouble with paperwork and things like that. And she's been happy to, in her role as the HDEA president and really just a good colleague, reach out and help that person successfully navigate some things in the workplace that they're going through. So we're really proud of her. What? I will. I'll get there. And so we're just very grateful. And as I said, she's also our HDEA president. And I have to say that she is so incredibly committed to serving her colleagues and coworkers and ensuring that they have a fair workplace, and I so appreciate that. So, Vanessa, will you come up, please? Absolutely. So, Vanessa, thank you so much for your 25 years. There's a camera
There's
somewhere.
a camera somewhere. Good, my sister doesn't have to capture a screenshot then.
Thank you, Phil.
Thank
Do you have anything you'd like to say, Vanessa?
Sure. Well, when I graduated from Clarkson way back in '92, a couple of classmates already worked at the Douglas County Hospital, it was called at the time, and they said, you know, come apply. So I did it kind of as a filler. I didn't think I would stay, but I loved the work that I did there with opening up the Alzheimer's and Dementia Unit, which used to be called CC2 East. Now it's got a name, and I can't remember it. I said, if you want me to know where to go, you got to give me the number. And then those two same friends also then went to the health department through the Access Medicaid program. And so I followed them and did that for 10 years until that program from the state was eliminated, and I ended up in the STI control department. I wasn't sure that I could talk about sexual health as much as I do now. My sister says that this job has ruined my mind because there's not much that will make me blush anymore along those lines. So for having started out as a filler job right after school, I have loved every day of serving the residents of Douglas County, whether it was in the long-term care setting, through helping them choose a medical home, and now providing for sexual health education and getting people the assistance they need. And also, it has been an honor to serve as the president of the HDEA, and 30 years in, and I don't think 30 more, but at least a few more. And I thank you very much for this honor, and it's good. But I am going to go around and fist bump because COVID's over, so I am going to go and
Come
make
on
my
up,
rounds to the board to thank you.
Fist bumps ensuing.
Fist bumps ensuing.
Yes.
Because my sister will probably still try to get it straight here.
Yep.
Thank you. Thank you. Wait, we're going to stop because this is the center.
Nice.
She'll get that. Thank you.
Thank you,
Thank you very much.
I believe we also have her two supervisors here, Allie and Leah. Do either of you have anything you would like to add to Vanessa's 25 years?
I always hate having to come up here and have to look back, but it has been awesome working with Vanessa. The one thing I can say is that she truly has the best demeanor when it comes to patients and talking about sexual health. Listening to her is always the greatest thing. So, once again, thank you, Vanessa. We've enjoyed having you for this year's and look forward to the next few years. So, anyways, thank you, Vanessa.
Hello and good morning, everybody. I'm Alejandra. I'm Ali, and I have the honor to be Vanessa's supervisor for the last year. But in this time, I've also had the pleasure to be her coworker as a DI, and I can say that she has an incredible sense of humor when it comes to working with patients, and also an incredible sense of helping the community. She has developed some projects. She helps other DIs in the county. She has developed some procedures for the county too, for our office. So she definitely is a great asset to have in her office. She's always so happy to talk to people. She's always getting the help or giving help to everybody. So I'm really happy to be working with her. And I'm really honored to be her supervisor and having some words for her in this morning. Thank you, Vanessa. Thank you.
Thank you. I believe we have one other, and I apologize to this individual that we do not have a certificate for him today, but I believe it is also Justin Frederick's 20 year. Is that right? That's incredible. He doesn't even remember at this point. So Justin Frederick is our chief of EPI and preparedness, and you know he was promoted into this role almost. Gosh, it's been probably close to a year now. I feel like he's been in that role a little bit longer, but he has been an incredible asset to our department in just his ability to initiate positive change and to really look for the actions that are going to help us be most successful and that are going to really reach our community in better ways. He's so active in just about every part of the department. He's been doing his very best to help me tear down silos so that we're doing more cross-collaboration work, which I think you're going to see an example of when I'm finished up here talking. So very much looking forward to that, but I just am very grateful for all of the assistance and just the amazing work and really the ability to rise to whatever challenge is out there. So if you'll remember, obviously we went through COVID, which was not pleasant, which he and his team really, you know, were doing a lot of the DI work and the surveillance and things like that. And then we had Mpox hit concurrently with our COVID pandemic, and he was very able to not just adjust to kind of a new threat in the community that we needed to address, and to hit it really with just as much gusto as we did COVID, but to also continue keeping COVID response work happening. And so I'm just very, very grateful for him and his 20 years here. And he jokes with me sometimes about the number of years that he likely has left with us, and I usually double that when I answer him. So I'm just very grateful. Justin, thank you for everything you do. And do you have anything that you would like to add? You don't have to, but if you want to, you're welcome to. Okay. Good deal. So thank you, Justin, for your 20 years. And with that, I'm finished with my report this morning. Thank you.
All right, a couple presentations. Oh no, we have the Justin. Yes.
Okay, so I forgot that got put under my report. So yes, we have Justin and his team actually here this morning to talk about our Mpox response. We wanted to kind of fill you in about how we've been going about that and highlight some of the great work that's happening there. So Justin and team.
Hey, good morning. It's been 20 years. That's crazy. This morning, I'm really excited to share with you some of the fantastic work that we've been doing in preparation for Mpox. I have two of our, I would say, experts of many in the health department here with me today. Blake Frederick, no relation to me that we know of yet, and Lana Dane. This is a really great example of us bringing folks together from across divisions and really tackling this public health issue as a team. So I'm really excited to share that. It's also a really great example of targeted risk communication and prevention. So without any further ado, I'm going to turn it over to these two.
All right, so my name is Lana, and I'm a disease investigator in infectious disease epidemiology.
My name is Blake Frederick, again, no relation to Justin. I'm a community health educator in the Division of Health Equity and Planning.
So before we get started, we wanted to give a brief overview of Mpox since it's been out of the news for a little bit, maybe not front of mind. So the mpox virus is part of the same family of viruses that causes smallpox, but the symptoms that people with mpox experience are a lot less severe than smallpox, although similar. Symptoms typically start with like a prodromal fever or headache, symptoms that start a few days, usually before a rash. The rash used to typically be found on like soles of hands and feet and all over the body. Mpox is spread through close skin-to-skin contact, usually intimate contact, and the lesions are often described as very painful. So in 2022 was the first time that there was sustained global transmission of Mpox. Mpox was discovered first in humans in the 1970s in West Africa. So it's certainly not a new virus, but the way that it was spreading in 2022 was very new. And that's because it was spreading primarily through sexual contact, and especially among the gay bisexual men who have sex with men community. In this outbreak, the lesions were often found on genitals, intraanal lesions in the mouth, and similar to previous presentations of Mpox, those symptoms usually lasted about 2 to 4 weeks. So in Douglas County during the 2022 outbreak, we had a total of 25 cases, with the last case being reported in September of 2022. And although this seems like a small number of cases, those people were in a lot of pain, and the whole process of investigating cases and keeping in contact with cases while they were sick was extremely resource intensive for the health department. People needed to stay isolated until their lesions had fully scabbed over and fallen off, so that can take up to 3 weeks. They're infectious until that has occurred. And so during that time, they needed a lot of health navigation needs, and then our team in epidemiology was in close contact with those cases, texting them daily, helping coordinate their hospital visits, sometimes past the extent that, past our job description. And we were also in contact with providers and hospital systems. We were making sure that healthcare workers who might have been exposed were also receiving post-exposure prophylaxis. So it was a very, very busy time for the epidemiology department, despite there only being 25 confirmed cases. So since the virus that causes Mpox is similar to the family of smallpox viruses, there was already an existing vaccine that could be used against Mpox. So by April of 2023, DCHD had administered 678 second doses of JYNNEOS vaccine. So 678 people in Douglas and Sarpy County were fully vaccinated based on the efforts by DCHD. And this does include healthcare workers. So it includes people who are at high risk of exposure to Mpox. So majority in the gay, bisexual, men who have sex with men community. However, that also includes people like sex workers, healthcare workers. There's a couple other sections of people that could have been vaccinated at that time.
Okay, so just real briefly, I'm going to touch on our ad campaign that we did last year. So we heard pretty quickly that our messaging was not reaching the right people in the right way. John Carl with the For Us Center, who's here with us today, was really gracious in connecting us with Commando, who are LGBTQ+ ad specialists in Hollywood who do this work for health departments throughout the country. So we were able to execute a contract with them and start a campaign that ran on dating apps throughout Douglas County for folks to get connected on education awareness around Mpox. This ran from October 30th to January 30th. As you can see, we had some really large impressions. They were seen over 830,000 times and actually clicked on and taken to somebody 1,000 times. So way to think about impressions and click-throughs, since I'll talk about it a little bit, is like a billboard. Impressions would be everyone looking at it driving by. Your click-through would be picking up the phone and calling that number. So really, the moral of the story, we had great reach, but bad timing. You can notice we didn't start until a month after our last case, so it was a little bit out of the public's concern at that time. So we definitely have an opportunity here in this year to move a little bit faster.
So our Mpox communications group continued meeting after that campaign ended. We met probably monthly, and then as we got towards the spring, we knew that Pride and summer events were going to be a potential source of new Mpox cases in our community. So we wanted to plan ahead to vaccinate more people and kind of figure out how to protect more people prior to those events. And around the same time in April of 2023, the CDC came out with a risk assessment, which found that states with less than 35% of vaccination coverage were more likely to see resurgent outbreaks of Mpox. And Nebraska as a whole has about 34% of the population at risk covered with Mpox vaccination. And that estimate, the denominator for that estimate is based on HIV services, as well as there's an extra 25% added for healthcare workers, sex workers, some of those other folks that could be vaccinated. And so we kind of used that, found that data and went back to analyze our Mpox vaccination data to kind of identify gaps in our vaccination response. So you'll see in this table we have Mpox cases in the first column by race and ethnicity, followed by vaccination, first doses by race and ethnicity, and that denominator is based on those who reported race and ethnicity. And then the third column is the population percent of Douglas County by race and ethnicity. So what we want to highlight here is the disparity among Black non-Hispanic folks, where you can see that they accounted for 16% of our cases, but only 6.2% of those who were vaccinated. There's a similar disparity in the Hispanic population as well. And there are a few caveats to that data. People from Sarpy, Cass County were also vaccinated in Douglas County, so it's not a perfect analysis, but it gave us a good idea of where to target our efforts this year for Mpox prevention. So shortly following the risk assessment and our group already kind of trying to figure out what to do next, we were kind of waiting for something more to come from the CDC because we hadn't heard very much about prevention prior to Pride. But then on May 15th, a health alert network was sent by the CDC, and it reported cases of Mpox by the Chicago Department of Public Health. At that time, I believe it was 12 cases that were reported, so kind of a small cluster in Chicago. But a lot of those cases were vaccinated, so it kind of raised some questions about vaccine efficacy and risk behaviors. But a follow-up MMWR article by the CDC did find the vaccine efficacy of the smallpox vaccine used against Mpox was 75%, provided 75% coverage for those who were partially vaccinated with one dose and 86% for those with two doses. So the vaccine is still as effective as expected, but we know that people, you know, are partying and out and about and just despite community levels of vaccination, there's still a chance of exposure to Mpox. So as of today, these are kind of the case counts that we're seeing in our area. They're up to about 39 cases in Chicago. There have been 2 in Minneapolis, 1 in Milwaukee. So cases are starting to kind of pop up, but we haven't seen anything major yet.
Sounds good. So with that, some money did come through from the state for emergency funding around Mpox. We received $11,000 in public health emergency funding. We moved quickly to position that with Commando to make sure that we were meeting the mark as far as time this time. So we partnered with Nebraska AIDS Project and the Ferez Center to get some messaging around kind of a summer in health and safety checklist. This is in line with some CDC information they put out. So we created some messaging with CDC resources as well as a list of sexual health clinics that you can go and get PrEP, HIV, or Mpox vaccination, kind of all the stuff that you would need, as well as a survey link that can take you directly to our sign up to get signed up for Mpox vaccination. So this information can be found on the dating apps that are used, and Commando they work with all these groups. They know exactly who to target on each of these apps. And then there's a mobile landing page actually that once you click those apps, it will take you to, and that's where all that information is housed. And we just launched this on June 1st. So here are ads. On the left, you're going to see those are in line with our CDC messaging, which is kind of the 3 options, which is getting tested for STIs, getting the Mpox vaccine, and stopping overdose through carrying Narcan. The second side are truly Mpox vaccination focused, getting both of those doses, checking yourself and your partners for symptoms, and then again, STI testing. So the message here is really highly targeted, highly effective. So the creative really matters on what we're using. Something lackluster will not show the same type of engagement that we'll get with these ads. So once you click those, you'll be taken to our mobile landing page created by Commando. As you can see, you can click and immediately schedule a vaccination appointment. You can also scroll through, get some information on STIs. There's a list of all the providers in Douglas County, and also some information on how to get connected to where you can find Narcan through Stop Overdose Nebraska. The last piece here, I usually wouldn't share this information this early, but Commando is really, really jazzed about how this campaign is going. It's actually one of the best they've ever seen so far. So we've only been going 2.5 weeks, and we've already met our clicks from our last 3-month campaign within 2.5 weeks. We have over 1,000. We have a 3% click-through rate on dating apps, which on average you get a 0.03. So we're at 3% currently. And then 14% on Google AdWords, where on average is about 1%. So what this really tells us is people in our community are looking for these services, and through this campaign, they're able to find it. So now it's really on us to make sure we're removing as many barriers to accessing the vaccine in these services, but so far it's really exciting. Also, all this data, we only have 30% of our campaign currently running. So this is really, really exciting to know that we're not even on all the apps or anything yet, and we're already seeing these numbers. So one other thing is we have expanded this campaign. So Lincoln, Lancaster, Sarpycast, Three Rivers, Potawatomi are all collaborating with us. They've hopped on. They'll be using these same ads in their jurisdictions geographically. And so anyone throughout basically eastern Nebraska will be seeing these ads and have an opportunity to click on it and get access to these services.
Another piece of our prevention activities this spring, through partnership with NAP, we offered vaccination at their NAP clinic in Benson on Benson First Fridays during their Pride event on June 2nd. So these community vaccination events are really common in bigger cities. Like I know in San Francisco, they have a lot of success like with pop-up vaccination clinics on street corners and people just walk up and get vaccinated. And we didn't know how successful that would be in our community because it's something we haven't done. It's a little bit more of a conservative community compared to some bigger cities. So we did have one person get vaccinated at the event, which was honestly great. Like we didn't know if anybody would, so it was nice to see that that did work. That event was also a Pride event, so a lot of the LGBTQ community who were at the event were also working and doing drag shows or selling their art and like different things. So a lot of people said if I wasn't working, I would maybe get it. So it'd be interesting if we try again to see if more people get vaccinated. And then we also did have education and resources as well as iPads where people could sign up to make a vaccination appointment. And so we did have a couple signups from that event. And I believe through the survey and that event, we've had over 20 registrations so far since the campaign went live on June 1st. And then people can also just go to the Douglas County website and register for a vaccination appointment through our MPOX page there as well. So we've learned a lot through both of these processes. Firstly, learning that our messaging wasn't reaching the appropriate community was extremely valuable, and we certainly need to continue improving and building relationships with community partners, whether that's within the LGBTQIA+ community in Omaha for MPOX specifically, or relationships with refugee groups. An outbreak could occur among any population group, so having those existing relationships will really help with any outbreaks moving forward. We need to continue exploring opportunities for expanded access to vaccine. One of the projects within this was reaching out to different clinics and health services in our county to see if anybody would be willing to offer MPOX vaccine who wasn't already. And we were able to get vaccine in NOAA, which is the North Omaha Area Health Clinic. However, there's certainly room for more clinics to offer MPOX vaccine and increase access. The concept of process evaluation is really important, and that's changing what we're doing based on community feedback. And we certainly have room to improve with that as well and continue to respond to community feedback. Our emergency response coordinators did an after action report with the health department and and reached out to community partners to find out what we could do better. So we still are in that review process for the after action report. And I think one of the big successes with this campaign was that we did continue meeting as a communication group when cases were low. And so continuing to plan during those lulls and just like keep an eye on what's going on is really important as well. And I think that that's all we have for you today, but we're definitely open to questions.
Well, props to the team for thinking outside the box and getting creative on the, getting the message out. So nice job on that.
First, I would want to ask, you guys kept mentioning HIV. Is there a strong correlation between those two with the open sores? And are we seeing that? Are we tracking that?
So, well, HIV also primarily affects the gay, bisexual men who have sex with men community, and those with HIV are at higher risk for severe complications from Mpox. So we do see a lot of co-infection between people with HIV and people with Mpox, and just yeah, they can get a lot more sick and more likely to be hospitalized.
I was kind of asking the other way. Because you have the monkeypox and the sores, is HIV being transmitted with it at a higher rate than we're typically seeing before? That's what I was.
No, HIV would not be transmitted through sores, from what I understand. I'm actually not in the sexual health section. I'm in epidemiology, but I know that Mpox virus has been found in bodily fluids, and HIV is transmitted through fluids, but it's kind of hard to tell. Usually, if people are transmitting fluids, there's also skin-to-skin contact, so it's kind of all happening at once.
So, will the monkeypox vaccine from now on be offered on a yearly basis, so to speak, in the sense of if somebody comes in with an STI, and then you said you're encouraging them who are at greater risk to get the monkeypox, will that be ongoing like next year and next year and next year? Is it like the flu vaccine in the sense of always be available?
Yeah, so people don't need a booster, but it is something that can now be like integrated into normal sexual health care. For anybody who's at risk, they should receive both doses of the vaccine at least once in their life.
We did receive some stuff from the community saying like, do I need to get a booster or anything like that? So we added some messaging to our website so folks know that if they were up to date last year, they don't need anything this year.
Okay, and one other question on that initial group of individuals, that there was like 80 people who didn't come for the second booster, and were you able to track those people and find out?
Yeah, so our clinic did work really hard on following up for second doses with folks. We were also open to anybody who was in Douglas County, even if they were traveling and visiting, to be able to get the vaccine. So some of those folks might not have been here and might have gotten their second dose elsewhere. And the first dose is actually found to be really effective at 76%. But yeah, our clinic was doing follow-up. And people can like still come back in and get their second dose despite how long it's been. But yeah, our clinic does reach out to individuals and try and help with those no-shows.
So, so is it a yearly type, or once you get, ideally both doses, is that pretty much lifetime protection?
Yes, at this point, there's
there's
always longitudinal research that can come out down the road, but for now, yeah.
So, I was just thinking about the fact that if the data says that this is a one-time, get the first and the second dose, and it's a lifetime, pretty much, vaccination. Is that something that you could really highlight in your campaign to indicate that this isn't something you're going to have to come back year after year after year, that it's,
Yeah.
What's it? Yes.
Okay.
Just need to be hesitant to the piece that there may be a need for something in the
Right,
future. So
but
right now, that's why we really say to keep yourself and the community safe right now, the best thing is to get those 2 doses, and that's all you need. So don't really put anything beyond that, but just keeping yourself safe with those 2 doses, and from that's all we're asking at the moment.
Okay.
And we have the ability with Commando. Let's say we have cases locally, we can change our messaging immediately to make it more targeted towards exactly what you're talking about.
Okay.
All right.
Thank you.
Other
Thank you.
questions?
Thanks.
Thank you.
So thanks for that presentation. So we have a couple other presentations today. Our next one is on environmental health division update from Dr. Figgs.
Good morning, board members. Let's see if I can navigate my way out of this. I might need some help here. Okay, here we go. Let's see, how do I want to do this? Where is it? That's how I want to do it. Reading.
Start talking.
Did you get go ahead. That's the screen I want. Okay, is it being shared? Okay, good. All right, let me set my timer here. Make sure I don't exceed the oh. Can you hear me?
Let me see this.
Oh. That bar.
Yeah, I don't know what that is. We're just gonna do this. What is happening?
Okay. Let's see what I have to do. All right, I'll try this again. Good morning. I wanted to set my timer so that I wouldn't go over here. Start. Okay, this will be a brief overview of Douglas County Health Department's Environmental Health Division. I ask you to please reserve your questions to the end of the presentation. The slides are numbered in the lower right-hand corner. You'll see this number 1 here. That's the first slide. If you see a slide that piques your interest, just say slide number 1, and then at the end we can go back to slide number 1. Okay? I want you also to contemplate this question as I do the presentation. I will come back to this, and you will get an answer to this question. Okay? This slide sort of describes, in my view, what I think is the EH division as a program equity model program. And I'll sort of get to that notion as I bring this along, because the whole emphasis on equity and environmental justice really has kind of changed my entire view in many ways of how I even look at environmental health. And so 10 years ago when I came here, equity wasn't necessarily on everybody's mind. Now it is, and so you have to kind of recommit or revision, if you will, your program. This is how I see the relationship between the core functions of public health, assessment assurance, and policy development, and equity, and environmental justice. So this is sort of like a model that I'm carrying around in my mind now about how all of these pieces are going to fit and what it is that we're going to do to make sure that we're sort of integrating all of this into the program at once. And so you might get the idea, you might get the feeling that, well, this is going to happen over a few years. This is not something we can do overnight. It might take several years, actually, probably 5, maybe 10 years to get all of this done when you think about the entire problem. But let's just sort of center in on assessment assurance and policy development, equity, and environmental justice. Now, in this slide, what I'm trying to do here is summarize the essential public health service that's associated with assessment, right? And I did this to really focus on the day-to-day that we do. So part of this presentation is about what we do, or what the division does on a day-to-day basis. Most of you know some other stuff. If you don't know, kind of like I'm trying to give you sort of a broad vision of what we do. The second half of the presentation is really about the goals of the division and the actions that we're taking to complete those goals or achieve those goals. So if you look at this assessment issue and say, well, what is the essential service that you're providing? The essential service that we're providing is monitoring. Monitoring hazards in our environment. And I'm going to run through these very quickly. So this is sort of a what the this is a food safety example, for example, of what it is that they're monitoring. They're really monitoring violations in the food code, okay? And this would be another example for food safety. This essentially shows sort of where they're doing this monitoring, and it also distributes the work. You kind of get an idea in food safety how their work is distributed, what they do most of the time, okay? And this I put in here just to kind of give you an idea that these are some venues that you typically don't associate in many cases with food safety. Fire calls, yeah, those are fairly common, but the one on the right, an accident on Interstate 80, is not typically what you would think that the food safety folks would be involved in. That particular trailer was full of produce and other consumables. And so somebody has to make a decision as about whether or not that food is safe to be consumed. This is an example from the sanitation section on what it is that they do. And you can see how their work is divided. Swimming pools, 50% of their efforts have to do specifically with swimming pools. And this is an example of where some of the things happen that they monitor. A community complained about an odor, and it turned out to be a landfill, or we do mosquito trapping every spring and summer. And this is what you'll see, and this is where you will see them do these kinds of activities. Here we have air quality, and these are their activities really divided by the distribution of grant funds that they get. So it's not exactly where they spend their time, but it's sort of where they're paid to spend their time. But at least you get an idea of what it is that they're doing, and that's really the whole function of these pie charts. And this is where they do it. These are locations where air monitoring occurs in Douglas County. Russell Haddon over there, he's going to give a more detailed version or a detailed presentation on air quality. And so I want you to really look at what I'm saying. These are just sort of like brief presentation or brief pictures, essentially, of what's really going on in the health department and the environmental health division. Now I'm going to really go back to looking at this really as an essential service and using the essential service as examples, if you will, of some of the things that allow us to set our goals and then the actions that it is we're taking. In this particular slide, we're just looking at assessment as a core function, and then the essential services that are associated with that core function. The goal, again, at the essential services is monitoring environmental hazards. The goal is to lower the hazard prevalence, and the action that we're taking essentially is we're monitoring violations in the community. If the essential service is educating the public about environmental hazards, what's the goal? The goal is to educate and inform the public about hazards. How do we do that? Well, in this case, we did it in combination with Dr. Hughes and Phil Rooney, who got us some media coverage really for this event. And the upshot of this is really just to educate the public that there is a hazard in the environment that they should take note of. Respond to environmental health concerns. What's the goal? To respond by participating in community-driven meetings. The action that we're taking is to participate in the discussions that are being led to some extent by OPPD, and it involves, in many respects, residents of North Omaha and their concerns about air quality. These meetings have been going on for some time. I have participated in 2 specific ones. Other members of the health department, not limited to environmental health, have also participated in these discussions, and they are ongoing. And I believe Friday I have another conference call on the same issue. Here again, we're talking about assurance. What are the essential services? Here are 3 of them: to build skilled workforce, to build an organizational infrastructure, research and evaluation. Okay. If you want to build a diverse and skilled workforce, what do? What's your goal? To improve and develop staff leadership skills. What are some of the things that we've done? Those are the actions. Okay. The essential service in this case is to build an organizational infrastructure. What's the goal? To develop policies, procedures, and protocols embedded in routine practices. What are some of the actions that we are taking? Those are the actions. Adopt the FDA voluntary retail food program standards. That is one action that we are taking. Okay. Okay. Again, a goal of one of the essential services is to increase staff awareness about the roles of legislators, the actions to inform legislators about the proposed regulation. Essential service, creating policies and plans. The goal, update, modernize environmental health policy, the actions. Those are the actions that we're taking and have taken. Communicating to inform and educate. The goal is to diversify information access, and these are some of the actions that we have taken or are taking. Now, equity. This is new for us. Well, it's new for me anyway. So it's new for me in the context of how do I provide equitable services, and how do I evaluate what we've been doing retrospectively, and then prospectively as we design new programs. And I have the question mark there. It says fair and just core functions. If you looked up CDC's definition of equitable, that's what they say, fair and just. Okay, so how do we get fair and just assessment, fair and just assurance, fair and just policy development? I don't know at this particular point. That's why there's a question mark there. Environmental justice. If the goal is fair treatment and meaningful involvement, those words, that phrase is actually located in the definition that's at the bottom of that slide. That bottom has a definition for EJ. So what is fair treatment and meaningful involvement, and what actions would you take? We'd have to establish criteria for it. We'd have to determine if meaningful is differential between communities. Does it affect communities differently? and assess the likelihood that proposed services will differentially harm communities. And what are we going to do about that if what we're doing is actually causing harm? What's the path to an environmentally just program? 3 steps. Define what your goal is, reinforce your goal by making sure that what you're doing is routine throughout everything that you're doing, and engage the public. I'm returning back to that model that I carry around in my head. You notice I've added community and I've added DCHD Equity Division. Now that we have a DCHD Equity Division, we can lean on them really to help us retrospectively look at our programs and also look at our programs going forward. We can also depend upon the community to tell us, are we headed in the right direction? If we're causing harm, where's the pain? And if the pain is so great, what it is that we can do to alleviate the pain in those communities. Threats and opportunities, global threats, climate change and economic models. What will countries do in terms of deciding what economic models they're going to choose to provide services for their populations? Locally, what can we do? What are our opportunities? Really is who we hire and what we hire for, and whether or not we strategically hire. Are we hiring for 5 years from now? Are we hiring for 10 years from now? As opposed to hiring just to fill a position today. And the use of technology, in particular IA technology. How are we going to use that? I see some advantages there, and I'm not exactly sure how I'm going to integrate that into what it is that we're doing, but I think there's some savings there. Here's that question: what is the number 1 environmental health priority? You can write it down on a piece of paper and ask yourself, what do you think it is? The answer that I came up with is it depends. It depends on who you talk to and what their perspective is. If their perspective is global, they'll give you an answer. Many of them will say climate change. But if you ask somebody locally, what's the priority environmental health issue for them? You might not get climate change. In fact, you might get climate, but with no change. Okay. Thanks to all staff who daily commit themselves to achieving these goals. Questions?
Dr. Figgs?
Yes.
What is the involvement of the Environmental Health Division with an entity such as city planning when they are proposing new built environment structures and other land use opportunities? Does the health department sit in on these meetings to weigh in on the environmental
We sit in on
hazards?
them, yes, we sit in on them, but we do not vote.
Well, I understand that, but
Well-
is there a presence for the city when they are building new entities to
Yes.
be aware of potential
Yes.
environmental health
Yes.
risks?
Yes, those can sometimes be very frustrating meetings, though, for us, because when we're there, we
Okay.
can have a comment, but it's as though the comment isn't heard, okay? But yes, there are times, I used to go to them all the time when I first got here,
Mhm.
but I found out that it didn't seem that we were having really much impact, and we couldn't vote really on what they were talking about. And so every now and then I tune in, but we have other staff who also have the agendas, and they can make written comments about concerns that they're developing in an area, for example, where there's something on the ground and they're not aware of it, where there's some structural issue that has to be addressed that they're not aware of. So we have written opportunities to participate, but in terms of just sitting through an entire meeting, those meetings can be quite long, actually. We have access when we want to.
Okay, so, and just to follow up, so related to assessment in terms of the role of education, do you see the Environmental Health Division then as one of their roles in terms of education to entities like city planning related to environmental health issues?
Well, I think in some ways we already, I don't know what you mean by education. I think in many ways we already have those connections, especially through our work with other city agencies, city planning, for example. Many of those relationships are informal. You know the people. You've been in meetings with them before. You have a question, you call them up. You know, for example, if there's a service that they provide that would help you solve one of your issues. I wouldn't call it transfer, those responsibilities and those things that we need to do. But there is, I think, a fair amount of communication across agencies when there is a particular issue for which we know we have the authority to do X, but we don't have the authority to do Y and Z, which is really what often the caller wants. The caller often wants 3 or 4 things. We may only be able to address one. And then we have to then say, well, have you called this person in this agency because I think they can help you with that problem.
Thanks for that overview. I appreciate the work the Environmental Division's doing.
Thank you.
I do have a specific question about air quality, but maybe I'll ask that question of the next presenter.
Sure.
But I was going to ask a similar question to what Dr. Wilkin just asked, in the respect that is your division involved or intend to be involved with the city's climate action plan that's being developed and starting this summer? And I think we'll have some specific recommendations and some actionable goals around climate change action planning, of course, but lots of other things too that could encourage this interaction with other city departments.
Are we involved? At some level, we are involved. It depends on how you want to really, at least in my view here, what does involved really mean? Are we participating in discussions with the climate action groups? Yes. How is that proceeding? For example, there is a conference called Friday from 12 to 1 of that group, and those are some of the issues that are going to be discussed in that meeting. There was also a recent meeting that we had with I forgot the young man's name, but he's from the mayor's office. He met with Russell and I on the climate action plan and the role that we might play in it. We don't know exactly what that role is yet. We realize that there is, to use the word, there's money on the table, and people want to, in some ways, make use of that money, that funding. And so they are looking to us to provide whatever support that we can provide. But that hasn't exactly been described to us yet, so we don't really know what it's going to be. But we are also involved in community discussions with North Omaha groups, which is led to some extent by a graduate student, really, at UNMC. So
okay. Yeah, I think that sounds like you're on the right track there, and I encourage you to keep doing that. I'll meet with him tomorrow as well. I think you're describing Marco Floriani in the mayor's office.
Yes, that's his name. Thank you.
We'll make sure you get plugged into that. I think that'd be an important connection for you. Thanks.
Yes. All right. Thanks, Dr.
No
Fix. I think that's all.
All right, thank you.
So we have our next presentation on air quality by Supervisor Russ Hayden.
Justin. Where's the from beginning?
If you go down here and click this.
This one? Yep. Alright. So are we sharing screen?
You can start talking.
Hi, Board of Health members. Appreciate being here and being able to talk about air quality today. It is my passion for the last 20 years, although I do have other involvement in the sanitation and sanitary engineering section. I am the supervisor for the air quality and sanitary engineering section at the Douglas County Health Department. And hopefully I'll give a decent presentation today, albeit very short. And hopefully you'll have some questions afterwards for me so I can fill stuff in. So this is for air quality, our air quality program, Douglas County Health Department. What do we do? What services do we provide in our air quality department? We do ambient air quality monitoring. Basically, that's the pollutants in the outside atmosphere. That's what we check. We also do some education on the indoor air quality environment. When people call in and have some issues, we try to help them out and educate them on their indoor air quality conditions in their homes. We also look at mold. There is no mold standard in the state of Nebraska, which if you guys would like to help on setting some kind of mold standard. So we have some extra enforcement as a health department, that would be great. We also do pollen counts every morning at the start of pollen season until the first freeze. We look for, in our ambient air quality monitoring, ozone particulates. Particulates are little small molecules, smaller than a hair. There's different sizes that the EPA looks for, PM10 and PM2.5. We also look for carbon monoxide, sulfur dioxide, nitric oxides. We have a meteorological station for the weather, and we also do chemical speciation, which basically breaks down all the particles, and we send a filter out to a laboratory, and then they send us back all the organics and inorganics in that filter. We run that like every 3 days, so that's always interesting to see what's actually all out there in those PM2.5 particles. This is our locations where we have monitors currently. We have a monitor in Bellevue, which does continuous PM2.5 monitoring, so we have real-time data. Same with Blair. We changed out a filter-based unit to a continuous type unit, so we got one more real-time monitor. In Ralston, we have a monitor, but that's filter-based as of now, but there's some funding that's coming through NDEE, and hopefully we'll switch that out to another continuous monitor, so even more real-time data for Douglas County. Downtown, we have a PM10 monitor, and we're looking at also switching that out to a continuous PM10. We do CO monitoring at Central Omaha, basically Dodge Street. That's for traffic. High carbon monoxide site, actually it's not really high, but we're checking carbon monoxide there because it's the possibly the higher site in Omaha. We look at SO2 in Northeast Omaha along with ozone. That's at 16th and Whitmore, kind of right next to OPPD. And then we have an in-course site, which is actually a kind of a health education site. It's not supposed to be around any kind of industry or anything that creates pollutants that would affect your readings within a city. So we thought 41st and Woolworth is a good site for that. There's really no industry currently right around there. And you should be able to compare all that data that we have at that site with another site, maybe in like Cincinnati or New York, because that's the way all these in-course sites are supposed to be cited, is that you can do scientific studies between city and see what those effects are. And that site houses a whole bunch of different parameters, as you can see below. This is a couple years ago, we worked with Douglas County GIS to create a dashboard, actually a whole website. We have a whole air quality website. This is our dashboard off that website. The website is douglascountyairquality.com. And here's just a dashboard they created, and has down below, it has all of the graphs, and that's all of our real-time data that the public can look at per hour. We also have filter-based unit data, which we used to have to, when I first got here, everything was filter-based, so you had to go and collect a filter, go back, weigh it, and then 4 days later tell the public, oh, you were outside on a bad air quality day. But that's no longer the case. We still have some of them around, so they are posted here. On our website, we have the current readings for what's called AQI for Douglas County. We also do a forecast, and this is one of those days that it was forecast for unhealthy groups, for sensitive groups, and on those days we'll send out an alert, basically to the news media and any kind of publications that would pick that up. When I pulled this off our website, it was up to 64, but I'm sure later on in the afternoon, it went above into that unhealthy for sensitive groups area. This is on our landing page on our website. Why do we monitor? If you've been outside in the last month, I mean, this is probably the worst air quality we've had in Douglas County since I started working here. It's been continuous for the month. Most of that is caused by the fires in Canada. We also had some wildfires and some burning down in Kansas and Nebraska that's also led to smoke. And it's just been one big basic smoke event that we've had here. And with that, we've had warnings for air quality in the smoke. Also, some of that smoke has been higher in the atmosphere, but when it starts to mix, like what it's doing now, we're winding up with higher ozone. Even though the PM levels are a little bit lower, that smoke being higher in elevation is starting to mix, and our ozone numbers have been really high, or in the unhealthy for sensitive groups for like the last month. Now, we really want to reach the public, so we get a lot of data. I mean, a lot of data. So what do we do with that data? This is just from our website. As you can see, one of the events, smoke events back in April, this is results from our website. We had over 1,000 people in a day, 1,200 people just come to the website. And then we had the bigger smoke event, which it was May 18th, and late in the day, the smoke came into Omaha. And from there, we had over 2,000 visitors to our website in just probably a few hours. So I think public education is getting out there. We're really reaching a lot of people to know that our website's there. The media is picking things up and putting it out there. There's a lot of concern in Omaha about air quality. I think we're addressing it pretty good, even with the news channels, where when you look at the weather, they're putting air quality on their weather forecast now too. I happened to be last week in Minnesota, and New York was having the smoke that came into the city, and the people were interviewing some of the citizens on the street, and many of them were like, I didn't even know this was going to happen, and most people were confused and what's going on. And I'm thinking, wow, I think Douglas County is way ahead of even many of these other cities on informing people on and educating them about air quality. Because most people know, if you ask them, well, what's happening out there today? They'll say those are fires from Canada, and I think that's very good for our education. But we still have work to do. Looking at the data, 72% of our website visits come from cellular phones, and only 26% now are coming from like a desktop. So we have to make sure our phones are actually really good with our website. And right now it's pretty good. I wouldn't call it really good. So we'll have to work with GIS to keep developing our website. Does the public care about air quality? Of course. This is the Knox fire that happened downtown. And of course the wind was out of the wrong direction. So when that fire happened, we didn't pick up a lot of the pollutants and be able to inform the people of what actually happened. So we met with our emergency response crew at Douglas County Health Department, and hopefully we develop a plan when something like that happens again. Maybe we get some SUMA canisters, set up some kind of perimeter around there, do a 24-hour monitoring why it's happening. We also got contacts with the EPA if it happens again, to get them up here. Just little incidents like that where you have to develop a plan afterwards. Hopefully you have the plan in place before it happens, but sometimes it just doesn't work that way. So you have to keep developing. This is some more of the news media that we had out there from some of the fires, the Canadian fires coming in, and some of the burning down in Kansas. The news media is very good at picking that up because there is a big public concern about air quality And I think it's just growing. It's becoming more of a citizen science for air quality. What are our goals for the year? We would like to improve techniques for notifying the public on air quality. That's always something that we try to improve on. We don't want anybody not to know with their kid that has asthma or respiratory conditions that, hey, the air quality is not going to be good today. We want to continue to be involved with our local community groups in Omaha. We're already working with like the South Omaha Task Force and North Omaha, some of the people there, trying to get the citizen science for them because they're really interested in air quality. So what do we need to do? We need to work with them on getting their citizen science going so they know more about air quality and how it works. And we need to seek avenues to grow funding for our air quality monitoring as well. You know, we aren't well funded. We get some funds from NDEE, which are pass-through funds. We can only run so many monitors. Everybody wants a monitor in their area, but we can't, you know, we just don't have the funding. Those things cost $20,000, $30,000, and then an employee to run them. So yeah, we have to actively seek out some kind of funding so we can improve our network and even be better. I think we're doing an excellent job for what we get for funding, you know, between air quality, website development, and, you know, AQI and public outreach, but it can always be better. What do we have to look up into the future? We got to be aware of quite a few things. This first photo here in 2000, this is actually trees. You know, in 2000, the tree lines didn't even really come into Omaha. You know, the density of trees wasn't there. Well, now in 2018, you know, you can see the development of kind of that arboreal forest that's coming along the Missouri. And what does that mean for us? You know, is it more intense fires? Invasive species that are coming in? You know, we got to keep that in mind. And also the change of the temperate zones with climate modification or change or whatever you call it. You know, those zones tend to shift. And what does that mean for us as a department? And also, you know, the drought. Right now we're currently in a drought. Is that increasing our air quality problems that we got going on? We also had floods, you know, so we have extremes here in Nebraska, and we got to be aware and on top of that. We do pollen at the health department too. That's on our website as well, and it is well received. There's a lot of people that just go on there every day to see what the pollen levels are. And we do notify the Weather Service as well, so their forecast is our forecast. We do mold as well. These are a couple pictures of some sites that we went out to. You know, the public does have quite a few complaints on mold, and the landlords, you know, trying to get the landlords to do something about the mold in the houses is extremely difficult because we don't have a level or an enforcement level that we can go in there and say, you have to, you know, fix this problem. And I think that falls upon either legislative or what to get some kind of standard set in the state of Nebraska that, you know, gives us a little bit of enforcement to go in there instead of writing a letter and saying we recommend you take care of the mold. You know, this is a lot of health concerns for people, especially for, you know, if they have asthma or anything like that. And this, so that's probably pretty much it for my air quality section. But I wanted to mention a little bit, I know it's just about air quality, but I wanted to mention a little bit about sanitation and sanitary engineering since I'm here, and how important the environmental section is for public health. Yeah, we're kind of the invisible department. You know, we don't get a whole lot of recognition because we're more into prevention. We're preventing people from getting sick. We're preventing them from dying in a pool or their water being bad. That just doesn't get publicly noticed unless something happens where we have to be there. So that's what I'd like to come here saying is, you know, we're not post something happening, we're prevention. And I always tell my employees, you know, I don't know how many lives you've saved since you've been here, because I can't record that. I can't record how many people jumped into that pool that you shut down, you know, the day before because they had no chlorine. So here's just a few of the articles on our sanitation department in the last 2 years. So we work with landfills, and then many of the construction people for pools. We also looked at, a lot of the debris landfill type stuff that's popping up around Omaha. People just dump it. It starts to become a dump site. And what's that bring? Vermin, anything else that causes public health concerns. Drownings in pools, we're there to make sure that the pool operator wasn't at fault for that drowning. We show up to those pools 3 times a year to basically check and make sure that they're operating these things correctly. We also monitor for mosquitoes. We do testing, or we go out and sample and set traps every 2 weeks. We just started a new grant on doing tick surveillance. It's a very, very, very small grant. But, we worked it in such a way that such a small amount of money, we got on the news on 3, 4, 5 different channels of us going out and tick sampling. That's a bonus. As long as you work these things right, even a small amount of money, you can get a lot of results. We shut down some businesses because they had, a rodent issue. And what if we weren't there? That rodent issue starts to spread. Those people go in, they buy food and snacks or whatever else. They get sick. They could die. So I have no idea how many lives we would have saved if we didn't go in there and shut them down. We also go into hotels and apartments and stuff like that for bed bugs and cockroaches and just trash that they put out beside the apartment complexes. Anymore, chickens we do domestic animal permits, and the reason for that, some people get frustrated that we're doing permits. Why do I need a permit for my chickens? Well, we need to know where they're at in case there is a bird flu epidemic or something like that comes down, that we can go out and we can inform them, hey, this is happening. You might want to keep a look on your flock. And they're booming. I mean, chicken permits are occupying a lot of our time. And this is the crew. We only got 3 people for air quality, so I know it looks impressive when you look at what we're doing. And these 3 people are the ones doing it. So Brian, Lizzie, and Chrissy. And this is my sanitation crew, which is a crew of 4. Well, actually, it's 5. I put Jeremy up there. He didn't pose for the picture, but we got Jared, Alan, Doug, who's part-time. And you might know Doug. He used to be my division chief. And now I hire him and fire him every year because he's just part-time. And John, and our new secretary, Carmelita, who is kind of the backbone of the whole thing. Now, originally when I got here, I think there was 8 people in sanitation and sanitary engineering. And we're down to, 4 with some of the budgets and whatever else. But Omaha is ever expanding. Douglas County is getting bigger. When we had 8, there was probably 500,000 people in Omaha. Now we have 4 trying to take care of all these kind of issues, and we're up to 800,000. Well, does that really make sense? Probably not. So if you have any questions, just let me know.
Russ,
Yes.
you mentioned there is no mold standard.
Mhm.
Is that specific to here or all across the country?
There is no United States mold standard, and there's none in the state of Nebraska. So there are certain states that have set their own mold standards. I think it's like 8 out of all the states actually have a mold standard. And that really makes it difficult, to go in and do anything, with the landlord besides for, try to show what kind of power the health department has.
So is this a potential contact state legislators to perhaps develop a mold standard for Nebraska?
I think there are plenty of people, that are living in conditions that they shouldn't be living in, that there would be probably enough backing to set some kind of mold standard that we could get, beyond going in and just having city codes write them up for the water leak. You could have another entity go in and basically give them 15 days to cut out the drywall and replace, the mold part.
Okay.
just because there's a standard set.
Second comment, on my phone, I have the weather app that I usually check every morning, and it has the air quality. I was just curious, do most people, I mean, it's a free app, in terms of if they knew the weather app for Omaha could be on their phone, they could, you know, click on it and it would show the air quality for Omaha every morning, so that anybody with a cell phone theoretically could tap into that? Or am I
There's
thinking-
multiple different weather apps, weather service. EPA has their own. We have our website. We also do forecasting that they can sign up for and get an email every morning. So there's a lot of people that pick up our air quality information, including like weather.com, or almost any of those weather apps anymore have an air quality type deal on there. Anytime we issue an alert, even my Alexa was flashing the other day, basically saying there's an air quality alert for Omaha.
Do you think that the general public is aware of the fact that if they had a weather app, they would be able to have information directly? You know, so for a family on a school morning, they could just click on the app and it says, oh, wait, really high pollen count today.
Yes,
In
I
terms
think
of educating the public.
Yeah, I think so. You know, I think we're at a good point in educating, you know, a lot of the public. Most people I talk to are like, oh yeah, I saw the air quality today. You know, and the same with that, you know, each like weather.com will have a tab for air quality. You know, many of the other weather apps too also have an air quality tab. And anytime it reaches a certain level, they're very good at like putting a little warning symbol on there that you click on and it says air quality is not good. And a lot of people are real interested in the weather, and air quality becomes part of that weather. So
I had 2 comments and then a question. I appreciate you bringing up the issue of the mold, and I want to make sure you are involved with the city's landlord registration process and our city inspectors in that case. In those cases, that is complaint-based, and it must be, but those kind of situations are not okay and are enforceable through that mechanism that the city council adopted through ordinance. So I want to make sure you're connected there. But then secondly, I do also appreciate the education about air quality. I think you're right. People do care about that. I get asked all the time when I'm walking around, you know, what's going on? What's that smell of smoke in the air? Whether it's the Kansas fires or the Canadian fires. And thankfully that wasn't worse for us. That literally shut down New York City. So that was amazing to see. So that is an important thing that could happen, you know, at any time. My question is related to air quality. There was a slide earlier in Dr. Figg's presentation that was of the North Omaha Commercial Club meeting at Florence City Hall that was concerned about the North Omaha power plant and the coal emissions and the situation that it's going to take a little bit longer than initially thought to convert that coal plant to natural gas. And the question being who's monitoring the air in the meantime so that the surrounding neighborhoods know and can be assured of, their knowledge levels of any concerns or air quality in the meantime. And I saw there's a air monitoring station at 16th and Whitmore, which I think probably is geared towards that.
Correct.
And so my question is, how can folks access that information? I think you said that's real-time information on the dashboard at DouglasCountyAirQuality.com. Would that be
that is
the right
that's
resource?
absolutely correct? Yeah. So yeah, we moved ozone monitor also. It used to just be an SO2 monitor there, but we figured, you know, with some of the pollutants, maybe ozone could be a trigger there as well. So we moved our ozone from like 30th and Fort down to that trailer location for those reasons as well. And both of those can be found on the website for real-time data. And we've looked for SO2, you know, the EPA and the Sierra Club and all those people do modeling in where the high concentration of SO2 is supposed to be. And we put trailers, you know, in that area and monitored for 3 years. in a couple of those spots just because the modeling shows that, oh, this is supposed to be a high, area for SO2, and all of those sites did not show that. Where our trailer is at currently does pick up some SO2 on an occasion, which most likely probably comes from OPPD.
Okay. So that trailer was moved there fairly recently?
No, it's been there for many years.
Okay.
Probably 20 years we've had a trailer at that location, and I think it's the best location that we could have down there for basically the stacks and where it could fall out and be picked up by our monitors.
Okay, good. I know some of those neighborhood associations were actively pursuing their own mechanisms to monitor it, but I'll help make sure they're aware of this resource too.
Right. We've been in contact with them about some citizen science that they want to do. They really wanted a PM monitor down there, but PM is basically transport. What we find at 42nd and Woolworth should be very similar to what's at 16th and Whitmore, just because how the air quality works. That PM molecules should be able to travel and be pretty much equal across Omaha, and our monitors show that. But with they still wanted to do it, so we recommended some citizen science monitors for them, which are relatively cheap, but it gets them involved in air quality monitoring, and we could help them, basically set up a monitor and put it next to maybe our official monitor, so they can see how their data compares with what our data. And any kind of citizen science, I think, is great. It just gets them involvement and more concern about what's going on.
Thank you.
All right, thanks for the report.
Thank you.
I think our last section, the board member comments on the committee reports that were submitted. Is there any questions on any of the reports from this month? Okay. Seeing none. So our next Board of Health meeting will be July 19th. Down here, and then there's a committee meeting on the first Friday of the month, which of course is open to anybody that wants to join via Zoom. Do we have an executive session or anything today? No, nothing. All right, so can you get a motion to adjourn?
So moved.
Second.
Wade. McNally. Festerson. Wilkin.